So with those cases in mind, I would pose to you the question again, what is the most dangerous sedative in oral surgery sedation? And obviously, I'm pointing my finger at ketamine. I think ketamine is a wonderful sedative when used properly. However, I think all too often we think of ketamine as being a, a safe respiratory drug, right? Because it causes bronchodilation, it doesn't depress the respiratory rate, and as a result, it's a great sedative, especially as a rescue sedative, to help smooth out those more difficult cases to allow us to finish the procedure. But I think we need to rethink and reconsider some of the effects of ketamine. Let me give you, for example, a small study that was published some 27 years ago in the anesthesia literature that looked at male volunteers and the oxygen consumption when receiving either fentanyl alone or fentanyl with ketamine. Okay? Now, as you would expect, when you look at those two groups, the fentanyl group had more respiratory depression and a decrease in ventilation and alveolar ventilation compared to the ketamine group. However, when you looked at the endpoints of oxygen saturation and arterial oxygen pressure, both treatments, that is fentanyl and fentanyl with ketamine, decrease the oxygen saturation similarly. In other words, ketamine seems to attenuate the respiratory depression with opioids, but does so without preventing a decrease in blood oxygenation, right? So all too often we focus on the respiratory rate, we focus on the left side of the equation, but we forget about the right side of the equation, right? Oxygen saturation also depends not just on our respiratory rate and how much oxygen we're being delivered, but how much oxygen we're consuming. And one of the interesting things about this study is that they emphasize the point that ketamine, because it is a sympathomimetic, increases oxygen consumption. And it's this increase in oxygen consumption with ketamine that appears to negate the effect or the attenuation effect on the respiratory rate. So if you're using ketamine because you think it's a respiratory safe drug, that's really only part true. Yes, it may not decrease the respiratory rate as much as other sedatives,